All right, so before we get into the serious part, let's have a little icebreaker to let us allow us to loosen up a little bit, and let's do this fast talk. Are you guys familiar with this? I was just saying this kind of reminds me of a segment in The Buzz. All right, so the mechanics are really simple. Each of you will be asked a question by me, and you are going to respond as fast as possible. Okay, so get ready, guys, because the first question is this. If you were to describe your business or company as a color, what color would it be? Dr. Rene.
Green.
Green. Okay, Noel.
Blue.
Okay, green and blue. Should we ask them why? Okay, maybe later. Next question. What is the activity that you thought you could not do until the lockdown finally happened? Doc Maya.
Let hundreds of people into my home virtually.
Hundreds of people. All right, Nino, what about you?
Come to work in shorts.
I wonder how many of us out of the 6 of us on screen right now are wearing shorts. All right. Okay, one question for Luigi. How many items have you purchased online this pandemic? It's been almost a year.
Ooh. I think too many to count. Too many.
Count? All right, I bought, I also cannot count, definitely more than 50. So there we're going online now, and it's just really, really very, very timely. So I just want to hear, Dr. Rene, why green in one sentence?
Well, doctors usually have green minds. Not really what you think, ecologically speaking, green.
All right, and Noel, why blue?
Well, it represents life and health, stability.
Okay, I like those answers, and they're also 2 of my favorite colors. So, all right, I'll kick off the Q&A by asking Dr. Rene this. How have your member hospitals adopted to the new normal? Of course, there's remote work, there's new techniques, I'm sure. And what were the biggest problems that you encountered that were encountered by hospitals under the pandemic?
Well, hospitals were able to, adapt quickly. First, because we have no choice but to do it. And also, we have to find ways to communicate. Otherwise, there will be no interaction. In terms of financial problems, of course, the perennial delayed funding from PhilHealth, coupled with very diminished admissions, have put the resources of the hospitals down to almost what they call as hand-to-mouth existence, or isang kahig isang tuka. We have decreased manpower mainly because a lot of staff, especially nurses, opted to take vacation leave, go overseas, and some we have to furlough or give forced leaves because of low admissions. And because of this, while it is lamentable, most of our hospitals decrease their authorized bed capacity to 50% or less.
All right, thank you for that answer, Luigi. This next question is for you. How can the telecommunications industry help the healthcare delivery system after the pandemic, or even now as we adapt to the new normal?
I think in 3 main ways. Number one, I think is always going to be in the forefront is connectivity, right? I think we've all mentioned it here this afternoon. The connectivity is a very, very important part, not just in the telemedicine or teleconsulting, but also in the managed services realm. But number 2, I think we have to stop thinking of our telco providers as just providing telecommunications. For example, PLDT is not Philippine Long Distance Telephone Company, right? We are PLDT Inc. now, and we have been for a couple of years. And what that means is we don't just offer, telco services, but we offer end-to-end fully managed services. And then the aim of that is really to take the problems of IT out of your hands and give it to the expert so you can focus on your core competency, which in this case for healthcare is really to save lives. And then lastly, I know we have some IT partnerships brewing specific to vaccine dispersal. So that's something that I think we can look forward to in the coming months.
Right. Let's just dovetail off of your answer, Luigi. I'm going to ask Nino this next question. Nino, will EPLDT also be coming up with solutions to help with vaccine dissemination? This is, of course, the hot topic nowadays.
Well, as Luigi had mentioned, yeah, we're working very hard with our partners and to develop new, I guess, solutions that work simple and effectively. That really are for to address the challenge of disseminating vaccines. No, and we're looking to get this out as soon as we can to support the ongoing initiatives.
All right. Noel, I'm going to ask you this next question. Of course, Noel, you're the founder and CU Doc, and I heard CU Doc's main objective is to make healthcare accessible to all, especially for those who have spent a long time traveling just to get to the nearest hospital. Now, given all the technological capabilities of your app, can you share with us some inspiring stories of patients or even some other use cases maybe of doctors using your app?
Thanks for the question. I like to share an inspiring story of a patient and a doctor. Mommy Lay is a patient that we helped last December. She is an entrepreneur and a mom. Her husband and 2 kids got sick at the same time with very high fever. There was a time they are planning to spend a vacation. She spent more than 3 days of chilling nights taking care of her family. Imagine the stress of being alone, taking care of her family at the time. It is scary to go to the hospital due to COVID. A friend of her recommended CU Doc, in which she was able to consult online with Doc Leia, who issued her a diagnosis and lab request. She was then able to avail of a home service lab test that identified the sickness as dengue. With medication, telemedicine, and home care, her family was able to recover from the sickness within 5 days. She was very thankful of our help that she even shared her story in her Facebook. Another story I like to share is the story of Doc Vanilla, a chief resident at OB/GYN department of Amang Rodriguez, a public hospital in Marikina. Due to the pandemic, their OPD department was closed for walk-in patients. All consultations were moved through their telemedicine program using Facebook. One of the big problems they encounter is that they can't cater to more than 20 consultations per day. Despite having a pool of doctors to accommodate many patients per day, Facebook can't manage to provide that feature. She approached us last October seeking for a solution. Within a few days, we created an online clinic for their department and provided trainings for their team to manage their clinic. After launching their new telemedicine program, they were able to cater to more than 50 online consultations per day and distribute them evenly with their medical team. I was truly impressed with their dedication to take care of their patients during these difficult times.
Thank you for sharing that lovely story with us. Dr. Maya, I have one last question for you. What is the role of the Academe in the changing health landscape? Of course, we keep talking about doctors and nurses and frontline workers, but they gotta go to school before all of that. Can you share us your experiences?
Thank you so much for this question. I feel that the Academe should always be part of the conversations in the industry. As physicians, we take an oath of service to humanity. But as physician educators, our task is to prepare the future physicians to take their place in the future landscape. And almost overnight, as we all know, the landscape has changed. So there has been an accelerated adoption of technology in every industry. And healthcare is no different. eHealth, mobile health, telehealth, teleconsultation, telemedicine, all of these forms of technology-enhanced delivery of service have to be closely mirrored in education, because we cannot simply leave our medical students to figure these things out on their own. But we actually need to be deliberate in the way we teach them the knowledge, the skills, and the attitudes to be able to practice medicine in the digital age of the future. So as a means of preserving high quality and effective education, for medical students, we have instituted what's called clinical augmentation. And there are many components to this, but among other things, our physician teachers were able to do virtual rounds with their patients and their students. They were able to do virtually observed procedures using GoPros in order to allow the students to observe the procedures. And of course, telemedicine is one very important component of this. So before COVID, telemedicine was already there, but it was not mainstream. However, because of COVID, all of us saw the benefits of being able to use telemedicine to safely address not all, but at least some of the health concerns of our patients without having to meet them in person. And we needed to be able to teach our students how to do a history, how to do a physical exam in the virtual clinic. And so these are just some of the examples of how it's important for us to be part of these conversations so that we can prepare the future physicians to take their place in the workforce. Thank you.
Thank you, Dr. Maya. Indeed, where would we be without tech and telemedicine and the internet in general and all these apps to help us out? All right, my chat box, aka my cell phone, has been going off the hook. This first question is from our virtual audience. Miss Mirasol Tew is asking, how soon can you provide the new services mentioned? Are these readily available? And how much cost will it entail for those who want to avail of this? Luigi, I think this is for you.
Well, the eHealth solution that Nino and the team demoed just today, that's actually available now. And there are available pricings already. So if you need to reach out to us, please feel free to reach out to myself or your relationship manager, and they can help you on that.
All right, thank you for that, Luigi. This next question is addressed to you, Noel. This is from our virtual audience member, Aniram Santos, who's asking how a patient can pay for the doctor's fee. Is the payment system integrated? And if they have an HMO card, can they use their HMO cards online or using telemedicine?
So for the patients, they can use their credit card and the e-wallet providers available now. And the good thing there is that we have a e-wallet system that whenever they pay for certain services, we are already able to disperse those to the doctors, clinics, and hospitals. As for the HMOs, we're still working with that along with EPLDT. It's a different payment flow, and so that's something that hopefully in the future we can also provide.
All right, good to hear that you're working on that. I'm sure a lot of people have HMOs and will be using HMOs. All right, our next question is from our live audience. This is from Janelle Delanon. Hi, Janelle. How are ya? Janelle, you can ask your question.
Hi there. I'm not sure which question that was. I actually asked three questions, but my first question was actually, could we go open source rather than proprietary cloud-based systems? Because we have those software or operating systems that are not mainstream. Like we could go Linux, we could go Ubuntu and such, which are not costly. Why should we go into proprietary, which are expensive?
That's a good question. Does anyone from the panel want to take that? So I'm going to ask the question again. I think the connection was rather choppy. Janelle was asking your opinion basically on going offline open source over cloud proprietary. Very technical question. Luigi? Or...
Sorry.
Yeah.
Nino, sorry.
I'm not sure I understood the question correctly. So, you're asking about the value of open source vis-a-vis a proprietary product.
Yes, basically that was the question.
Okay, yeah. So, well, as with any open source application, you know, the value would normally be off the bat in terms of support, right? Because with proprietary products, there would be a certain level of support that the provider would be offering. Whereas in terms of open source, you would have to usually rely on a community of users using the same tools to pretty much get the support that you need. And there are no guarantees with that, as you know. But yeah, I guess the difference lies in terms of what sort of assistance that a provider will be able to extend, as far as the proprietary applications go. Does that answer the question?
Janelle?
Yeah, that was a very, very good answer to the question. But although I would think that the community would be a better source of, support for the doctors or for the community as a whole.
All right.
Yeah. So
Thank
you're saying that the a community would be a good support group. Well, particularly for doctors, you're saying for the users. Yeah, that's right. No, for the actual end users, a community is always a good source of support in terms of knowing best practices and how to use the products, regardless of whether an application is open source or proprietary. Yes, I would agree that a community of users is always something that's good to have.
That's right. Communities are
Actually, just
always,
just to
if
give you
we're
the
talking
example.
about going online and virtually, the community is always everything. Thank you, Janelle, for that question. Our next question, I'll be reading it out because it's from an anonymous asker from our live audience. They want to know whether the telemedicine app runs well with mobile data and does it have an admin side for monitoring purposes? And also, how much is the subscription? Nino, I think that's also for you.
Well,
Yes.
I can
So
also, if
yeah,
that's okay. Um,
Do you?
so it does work well on mobile data. I actually used it. I used this solution just a month ago for an eye consultation actually. And I didn't use Wi-Fi. I was on the road as well. And I don't recommend to do that on the road. But it works well on Wi-Fi. It works well on 3G, 4G, and 5G as well. And in terms of pricing, we have standard pricing depending on hospital or clinic. And again, if needed, we can always provide that to you guys for through our relationship managers. Or please feel free to reach out to me.
Thanks, Luigi. Nino, would you like to add to that?
no, I think that covers it. Yeah, in terms of we would like to, as much as possible, tailor fit a proposal to each and every customer, and it would be good to approach your relationship managers individually to get an idea on the pricing.
All right, we have another anonymous asker from our virtual audience who works in a government hospital, which means that most of their patients are not well off. Now, this system that we are proposing today uses mobile data, which some of them cannot afford, frankly. Can you offer a cheaper way for them to be able to access the system? We're talking about indigent patients here.
I think the system in itself is always customizable. Obviously, we've been talking also to the LGUs. It's not just the system itself isn't just for private use or private owners. So again, it just depends on the specific scenario. So specific to government and LGUs, I know we have a government and LGU team, and they have they do have the eHealth product. So it's tailor fit, and we can customize it to the LGUs and to the public sector as well.
All right, very, very good to hear. The next question is again from Janelle from our live audience. This one goes out to Doc Maya. Janelle, would you like to ask Doc Maya your question?
Again, I'm not sure which question that was, so I'm gonna go on.
It's about the
probably
learning
it
difficulties of older generations.
Oh yeah, that's right. Actually, I'm part of the younger generation, probably Gen Y, and so we've got older staff in our hospital, in our medical facility, that would probably be difficult for them to transition from the mechanical and writing portion to traversing into that digital platform. So how long do you think would the training go, and how long do you think they could learn and adapt to the digital platform? Thank you.
I'm not sure if I got the whole question, but I think this was asking about adapting or the learning curve, basically, for how to use technology. Okay, so it's difficult to know where to start because, coming into this, we really know that technology was able to help us deliver services regardless of the industry. But, in addition to the difficulties with infrastructure, that's internet speed, the gadgets, the software, the hardware, I think possibly the most difficult aspect has been the people aspect because being a digital migrant myself, it hasn't really been easy. And there's this aspect of being afraid to start using certain platforms, no matter what industry you're in. But because of COVID, we all just were sort of forced to be able to use them. It became a choice of not being able to do what you needed to do, or having to learn how to use technology. So I think there's that sort of panic. There's the learning curve. But if you really believe in what you need to do, then you'd be able to find a way to get over the hump of the learning curve. And it hasn't been easy, but we've been able to help each other, support each other somehow. And I think one thing that we kept on telling each other is that we have to be kind. This is not the time to be a perfectionist. This is a time to support each other and to be kind to everyone around you, and also be kind to yourself, and moderate your own expectations also. So thank you.
Very well said. I think this just brings forth how much we are all works in progress, Doc Maya, and even having
Definitely.
a hard time adapting because sometimes there you someone, maybe it's a platform you're not used to, but we're all adapting and we're all getting there. I think even my mom is more of a techie than I am, using a virtual wallet ahead of me. All right, our next question is also from our virtual audience. Sorry, from our live audience. Roel Ceballos has a question for you, Noel. Roel, do you want to ask that question personally to Noel? All right, Roel, I'll just ask your question. So, Noel, Roel wants to know, your name's Rhyme. What will be the edge of CU Doc compared to other competitors that you might have?
Thank you for asking the question. So, CUDoc is really building towards a holistic, integrated platform. So, one of our key strengths is that we are open to partner with different providers in developing this holistic, secured healthcare ecosystem. The unique value that we have now is that when we develop the telemedicine, we also want to make sure that the stakeholders, these are including hospitals, clinics, doctors, and patients, are all integrated. No one is left behind. And that is our message. It's what we are, since we intend to bring the healthcare experience in the digital world, we are like a partner for hospitals to bring them to the digital world and guide them on how to adopt in a slowly, step-by-step scenario. This is what we bring, and And this is how we are continue to work in the future. Thank you.
That's right. So also, again, everybody a work in progress as we all struggle to adapt to the new or next normal. All right. This question I'm asking Doc Rene, Doc Maya, and Noel. So the three of you should be able to answer this question. After all the challenges that the healthcare sector has faced in the past year, what makes you guys the most proud to be part of this specific industry, healthcare, the champions of the last year? Doc Maya, do you want to go ahead?
Okay. Thank you for that. So I'd like to make a special shout out to all our medical frontliners who are also teachers. At no other time has their dedication to teaching been more evident than it has been during this pandemic, when they had to find a way to make time and to learn how to teach our medical students with their GoPros, their gadgets, their tablets, despite not being techie. And alongside all their other responsibilities, seeing patients in the hospitals, in the clinics, they were still able to do all this. And they say that behind every successful physician is the patience and love of a dedicated medical educator. So I just like to thank, the community. And more than anything else, this pandemic has been a time for us to reset, to revisit our traditional practice, and reaffirm what we value the most, which is really service to the patients. And in this way, we can also reimagine a better future for both doctors and patients with or without technology. Thank you.
Yes, and thank you also, Doc Maya, for being a teacher and a physician as well. Thank you for helping all of us here. Doc Rene, could we hear from you about the challenges in your sector? But, yeah, and also
Yes.
what makes you the most proud to be a doctor?
Yes. Well, first of all, COVID-19 pandemic is a healthcare problem. And being part of the healthcare sector, despite the fact that we lost a lot of our colleagues, families, relatives, and friends, and also patients, with God's help, we are still here, alive, continuing our role and mission of prolonging life, protecting everybody, and preventing the spread of the disease. I think let us all get vaccinated. Thank you po. God bless.
All right, thank you so much, Dr. Rene, for that reminder about getting vaccinated as well. Noel, do you want to add to that?
For me, I just want to take this opportunity to say that I'm very proud of my team. We have started this journey together 2 years ago with a big dream of making an impact in the healthcare industry. It was a difficult journey. We have sacrificed some personal time to help a patient connect with their doctor, or immediate profits just to help a hospital set up their virtual clinics, or even better opportunities elsewhere because we know the mission's not done. All of us sacrifice in their own way, but it's worth it. Somehow, in small way, we are also able to save lives by helping doctors save lives. And that is what makes us proud in this industry.
That's right. It definitely takes a village, starting with the hospital and all the tech that we need to function healthily in this environment right now under the pandemic. For Luigi and Nino, the guys that are playing support behind the scenes, very, very important. Also, what makes you most proud to be in your industry, which is, of course, telecommunications?
You want to go, or you want me to start?
Go ahead, Luigi. You're ready.
All right. For me, during the pandemic, especially during ECQ, we were very strapped in terms of connectivity, right, and making sure that everybody, and across all industries, right, doctors, retail, BPO, everybody, all the workers and employees could stay connected and do their jobs from home. So on a telco side and IT side, it fell to us to be the back end, driving force, to keep everyone connected, and also safe, because when you have the secure connection, when you have the secure reliability of mobile or the fiber facility, you don't have to leave your house, right? So I'm proud that we were able to accomplish that, and we're not perfect, but we're gonna get there.
All right, Noel.
No, well, for me, I think what makes me more proud is really the fact that we're actually in the business of supporting and enabling a sector that actually does all the help ever since. And I mean, the healthcare sector has always been there to support everybody, and it's an honor for us to actually this time be able to support them. I think that's something that we bear in mind and every day, and it's great to be able to do whatever it is that we can to help the nation, to help the country, and then the people in general through the healthcare sector as well.
All right, thank you so much again to all our presenters and panelists for spending this afternoon with us. And thank you as well for all that you do to keep us afloat in these really unprecedented times. And to all our audience members, all our viewers, thank you for joining us and tuning in today.